Several parts of India have been reporting a high number of influenza cases in the last 2 months with prolonged illness, lingering cough. After battling 2 years of COVID pandemic, the rise in flu cases has created a scare among the general public. The flu due to influenza A subtype H3N2, which has been in wide circulation for the past 2 to 3 months, causes more hospitalizations than other subtypes. The symptoms usually include a persistent cough accompanied by fever. In recent cases, a lot of patients are complaining of prolonged symptoms. The Indian Medical Association has said that the fever goes away at the end of 3 days, but the cough can persist for up to 3 weeks. It is advised against the indiscriminate use of antibiotics. Right now, people start taking antibiotics like azithromycin and amoxiclav, etc. without caring for frequency and stop once they start feeling better. This needs to be stopped as it leads to antibiotic resistance. Whenever there will be real use of antibiotics, they will not work due to the resistance, the IMA said in a statement. The IMA further added that these cases are mainly being reported in individuals between 15 and 50 years of age and cause upper respiratory infections along with fever. The association has also advised the doctors to prescribe only symptomatic treatment and not antibiotics. The most misused antibiotics are amoxicillin, norfloxacin, oprofloxacin, ofloxacin, and levofloxacin. These are being used for the treatment of diarrhea and UTI, the IMA said. Talking about the severity of these infections, Dr. Anita Ramesh, a clinical trial specialist, said that the new strain of influenza is not life-threatening. It is not life-threatening, but some of my patients had to get admitted due to respiratory problems. Some of these symptoms are similar to COVID, but all my patients have tested COVID negative. The ICMR has also issued do's and don'ts to protect oneself from the infection. The do's include regularly washing hands with soap and water, wearing face masks, and avoiding crowded areas. In cases of fever and body ache, the ICMR has advised the use of paracetamol. The don'ts include not to shake hands or use other contact-based greetings, not to self-medicate. The ICMR has said that the antibiotics and other medicines should only be taken after consulting a doctor. Harshal R. Salve, professor at the Center for Community Medicine, AIMS, said that the increase in the transmission of flu virus is due to abrupt climatic conditions currently prevalent. Serological surveillance through established mechanisms in the public health system by the government is essential to determine serotype of the virus and its endemic, Salve told IANS. Doctors from Primus Hospital, Chanakyapuri, noted that the patients with asthma and those with severe lung infections are finding difficulty in breathing. Elderly people, children and pregnant women are the most vulnerable to getting infected. Therefore, they must remain extra cautious while venturing outside, the doctor said. The flu is an infectious respiratory infection brought on by influenza viruses, according to the US Centers for Disease Control and Prevention. It can lead to mild to severe disease and occasionally even death. According to the CDC, influenza cases in India typically peak from June to September during the monsoon season, with subsequent peaks from November to February throughout the winter. As a result of the flu, respiratory sinusitis virus, adenovirus, rhinovirus, and other viruses, several doctors in India have noted cases of persistent cough.